exactly. We've got a really spicy Al today. I'm going to let you know Al is extra spicy today, okay? So just beware. Welcome to DBL. We've got the one and only Dr. Coley here with us. Thank you, Dr. Coley.
I want to be spicy too.
Oh,
yes.
I'm like, not like that.
Yeah, no. You stay the sweet and innocent Dr. Coley that we love and know, unlike Al. All right, we are going to start with a very shocking new headline. In fact, it feels like a science fiction movie. Elon Musk says his Neuralink company has successfully implanted its first brain chip into a human test subject. He said the patient is recovering well and the initial results are promising. Ooh.
All right, so let's talk about this because it feels like some type of a movie. So what exactly does this implant do?
It's a tiny little computer chip sits behind your ear, sends lots of wires into your brain, and it does actually read your thoughts. So if you have a thought that you want to do something, that little implant transmits it to an app that then causes a computer to carry out that thought, basically.
Well, that's interesting you say that because I feel like we suppress probably 90% of the thoughts we have, right? So is that always a good thing?
So I think, Al, you're raising some really important ethical questions. Is how does a computer know which thoughts you want to act upon and which ones are just garbage thoughts that come into your head?
I didn't want to do that.
I didn't want to do that, exactly.
Right.
And so this starts to raise a lot of questions about implementation of this, and then also who takes responsibility for when this computer starts acting on your thoughts if something goes wrong. Let's say you're driving a car with this computer and you accidentally have an accident, right? Then could you blame the computer and say, well, that wasn't the thought that I had. I wanted to turn left, not right. The computer malfunctioned.
But just your thoughts, and also just the greater concept of just creating basically a race of cyborgs is what some people are worried about. Is this something that's a real thing?
So I'm less worried about that because
RoboCop? Okay. Is that where you got your question from?
First of all, I got it from the prompter. But also, yes, I mean, kind of RoboCop in a way, right? His body was reacting to his thoughts. His body was lost.
RoboCop.
I was thinking iRobot with Will Smith.
No. Yeah.
No?
Well, I mean, that's more AI. I feel like RoboCop is a good example, even though Sam was trying to embarrass me.
So I'm not worried about RoboCops because we're using brain stimulators in medicine for decades. We've been using them for conditions like Parkinson's and other neurological conditions. We use pacemakers, right? If somebody's heart's electrical impulses stop working, we put in these computers that then generate these impulses. But it's the other direction that this is the first time we're doing, where instead of putting in impulses to control the body the way that we want to, we're taking out your thoughts and putting them into a machine and sort of carrying them out. So with this particular technology, I think my biggest concern, honestly, is that Elon Musk and the media has put it ahead of the science. I don't think the clinical trials in animals yet support putting it out into humans, and I think we just need more evidence because some of the studies from the monkeys showed us that some monkeys had seizures, they had brain swelling. Now Elon Musk is saying those monkeys were going to die anyways, and there are other reasons why they had that. But I think when the animal studies are a little sketchy, I'm a little nervous about putting it out in humans. Now, the flip side of that argument is that these are humans that have spinal cord injuries, ALS, and they're completely disabled. And to give them this back is a tremendous gift. So we wrestle with this conflict in science all the time. We want to get things out there quickly to help the people that need it the most. But how quickly is too quickly?
Wow, interesting. Okay, so let's switch gears here and talk about Shannen Doherty. She revealed that she has started a new treatment to help with her stage 4 cancer diagnosis. Here is what she said about it on her podcast. Listen.
I'm on a new, cancer infusion. And, after 4 treatments, we didn't really see a difference and everybody wanted me to switch. And I just kind of was like, we're going to keep going with this and see. And, after the 6th, 7th treatment, we really saw it breaking down the blood-brain barrier. Do I call that a miracle? Yeah. For me, that happens to be a miracle right now.
Wow. I hope that she recovers fully. What is it about brain cancer that makes it so difficult to treat?
It's the organ that we can't get to. So when it comes to giving chemotherapy or drugs for cancer, we have to deliver them to that organ, and then we have to make sure they're active in the organ. So delivery to the brain is one of the biggest challenges we have in medicine because the brain is surrounded by this membrane called the blood-brain barrier, which is actually designed to protect the brain. It's designed to keep out toxins and kind of control what gets into the brain because the brain is our master computer of our body. But when it comes to brain cancer or cancer, breast cancer that's gone to the brain, like in Shannen's case, how do you get the drug in the brain if they got this blood-brain barrier. So in the past, they've injected chemo directly into the brain. They've tried to use your immune system so that, immunotherapy, it's called, can get into the brain. But in Shannen's case, she didn't reveal which type of infusion she got. But it sounds like it's at least delivered to the brain, where then it can start killing off those cancer cells without hopefully doing too much damage to the other tissues that are there.
Wow. Crazy. All right, so that's very important stuff. Let's talk Stanley Cups, because this is also very important in society these days. It turns out that there's some tests run, and they're made with lead, right, inside there. What are the risks to this?
Yeah, so lead exposure can have real neurological cardiovascular complications, and we can eat lead, we can inhale lead, we can have different types of ways to get exposed to lead. The Stanley Cups are made with lead, but they're supposed to be coated with a stainless steel coating. So unless that gets damaged and you're exposed to the lead at the bottom, there's not really a risk to toxicity. But having said that, we don't really know what happens when you put your Stanley Cup in the dishwasher, and does that coating come off? Does it wear down over time? Are you getting micro amounts of lead that you're being exposed to? So I think this raises some good questions about many of the products that are out there that we use in our day-to-day basis. Day-to-day, like we cook with utensils.
Teflon.
Right. And how do those affect our health?
So they say if your pan cracks, you have Teflon pan, you should throw that away, right? Is that the same for parents out there? If your Stanley Cup, even though it's hard to get your hands on, if it's cracked, you should throw it away.
100%. Any kind of crack damage. And my question is, leaving it in the car, if it's very hot or very cold, how does that affect the coating? And these are things I think that these types of studies help us push the envelope on that need to be reported so that we can be intelligent consumers.
Oh, well said, Dr. Coley. We love her. DBL Nation, go and follow Dr. Coley on social media at Pyle Coley MD. Also, be sure to subscribe to her YouTube page, plus check out her podcast, Heart of Medicine, wherever you listen to your podcast. Thank you again, Dr. Coley.